Before you spend thousands of dollars at a fertility clinic, you need to know this. These are simple evidence-based steps that you might be missing, ones that can significantly boost your chances of getting pregnant naturally without breaking the bank. In this video, I'll show you what to check, what to fix, what to track before you even consider fertility treatment. These steps are often overlooked, but they matter, and skipping them could mean spending money on tests or treatments that you don't actually need. So the first step I'll be telling you about is understanding your fertile window. You can't get pregnant just any time of the month. You have just a 6-day window each menstrual cycle when pregnancy can actually happen. That's the 5 days before ovulation and the day of ovulation itself. And this is the reason. Sperm can actually live inside the female body for up to 3 to 5 days. And this egg, once it's released, it survives only 12 to 24 hours. So if you miss the timing, you miss your shot for the month, no matter how healthy you are. So how do you find this fertile window? How do you find your fertile window? There are 3 main ways I'll be telling you how to do that. The first one is the ovulation prediction kit. This tests for a surge in the luteinizing hormone called LH in your urine. So when this LH spikes, ovulation usually happens within the next 12 to 36 hours. So if your cycle is a regular cycle, start testing about 17 days before your expected period. For example, if you have a 28-day cycle, start testing from day 11. So you should test once or twice a day, especially in the afternoon when LH is more likely to be detectable in the urine. Also check your mucus, your cervical mucus. Track it. Is your vaginal discharge. Check if it is stretchy, clear, like egg white discharge. That's your body's natural fertility signal. You can also use cycle tracking apps. This can be helpful, but don't rely on them because their predictions can be... So your body is more accurate than any algorithm. So once you detect ovulation, once you detect those signs, aim to have sex that day and the 2 days after if possible. And the next step is, are you even ovulating regularly? You know, if your periods are fairly regular, coming every 21 to 35 days, then you're likely ovulating. But if your cycles are unpredictable, longer than 35 days or shorter than 21 days, ovulation may not be happening consistently. You know how I know this? Because I know what a cycle length is. Cycle length is the number of days in between your periods, counting from the very first day you see your period to the last day before you see your next period. A normal cycle length is between 21 and 35 days. So if your period comes every 21 to 35 days, then you're likely ovulating. But if longer or shorter, then you may not be ovulating consistently. And no ovulation is no egg, and no egg is no pregnancy. You can confirm your ovulation with a positive LH test like I mentioned, and usually your period comes 12 to 16 days after you've seen a positive LH test. So you can also check your basal body temperature. If there's a shift in that, you know, after ovulation, a hormone called progesterone will cause a small rise in your body's temperature. And how you do this is you check your temperature every morning with a thermometer. And if you notice an increase in your temperature by 0.5 to 1 degree Fahrenheit, then it means that ovulation might have occurred. You can also do a progesterone blood test, and this is done 7 days before your next period, and it confirms whether your body has actually released an egg. So if you're not ovulating, no amount of timed sex will work. Third step is check your sperm early, your partner's sperm. One of the biggest mistakes I see couples make is focusing only on the woman for months while no one checks the man. But here's the thing. Male factor infertility accounts for about 1 in 3 cases. So get a semen analysis done early. It's simple, it's affordable, and it gives you the info on sperm count, like how many sperm motility, how well do they swim, you know, sperm morphology, the shape and the structure of the sperm. You don't need a perfect sperm. You just need enough good ones to get the job done. But if there's an issue, catching it early, it saves time, money, and frustration. The fourth step is address lifestyle factors for both partners. This is huge, and it's something clinics don't always emphasize. And this is what I want you both to look at. Nutrition. A diet rich in fruits, vegetables, whole grains, and healthy fats helps to support hormone balance and egg and sperm health. I want you to also exercise. Moderate activity is great. Too much, like intense daily workouts, or too little can both throw off the hormones. Sleep. Aim for about 7 to 9 hours of sleep because poor sleep affects ovulation and sperm production. And high stress impacts ovulation and libido. So try meditation, yoga, journaling, anything that helps you to decompress really. Also try taking supplements. For women, you can take like a prenatal vitamin with at least 400 to 800 micrograms of folic acid. And for men, a basic antioxidant blend may help sperm quality. For example, vitamin C, E, zinc, and CoQ10. The fifth step is to rule out common medical conditions. Some medical conditions make it harder to get pregnant naturally, but they can often be managed effectively if caught early. So watch out for PCOS, polycystic ovarian syndrome. Usually presents with irregular periods, acne, facial hair, or weight gain. These may be the signs, but you don't have to have all of the signs. And then thyroid disorders like both underactive thyroid and overactive thyroid can mess up your cycle. Endometriosis as well, when you're experiencing painful periods, pain during sex, or unexplained infertility could also point to endometriosis. You can check for prolactin issues because high level of prolactin can block ovulation. So if you have symptoms, don't wait. Get tested and treated before assuming you need IVF. The sixth step is know when it's time to seek help. I'm going to give you simple guidelines. If you're under 35 and you've been trying for 12 months without success, it's time to consult a fertility specialist. And if you're 35 years old or older, then that window shortens to 6 months. And then if you have irregular periods or you've been diagnosed with a known condition or previous pelvic infections, don't wait. Get evaluated immediately. But again, many couples don't need IVF. They just need to track ovulation accurately, time sex better, improve overall health, or correct a simple hormone imbalance. I'm going to wrap this whole video up with like a simple, quick checklist of what to do before spending big at a fertility clinic. 1, track your ovulation with OPKs, cervical mucus, basal body temperature, check if you're ovulating regularly, get a semen analysis, focus on lifestyle, good food, sleep, movement, stress-free, treat any medical issues that may interfere with fertility, time intercourse during the fertile window. All these steps alone have helped so many couples get pregnant without expensive treatments. So before you go and spend thousands of dollars or even millions of naira, make sure you're not missing any of the basics because sometimes that's all it takes. If you found this video helpful, let me know in the comment section how long you have been trying and what's one step from this video you haven't tried yet. Thanks for watching and I'll see you in the next one.